Thanks very much, Caroline, and good morning, everybody. And I'd particularly like to thank Tess, Caroline and Ashley for inviting me to speak here. And I'd like to congratulate the ISPCC on a great piece of work and on setting the standards for both evaluation and including the voices of service users, giving them a voice in basically in the further development of services. So as you know, I'm just the warm-up act, and I'm going to talk on one aspect that will later be fully developed in the further presentations on the report that's at the centre of today's seminar. So I'm going to talk about service users. And of course I'm coming mainly, because my work is about child protection, I'm coming mainly from child protection, but I know very well that users of ISPCC and other child and family support services have often moved in and out of the statutory system, and in their own lives often don't regard services in the kind of technical way that we do. So it's a kind of a blur of people that they have to please somehow or other in order to protect their families and get on with their lives. So I'm going to give you a sort of general overview of research on service users' voices. But I suppose the question I'd want to ask, and I think it's so relevant with the amount of regulation, legislation and proceduralisation that we are currently seeing from the, from both the department and from the HSE, that we understand the impact of that on service users and what it's like to be at the receiving end of all of that. Because sometimes there's a sort of assumption that if you lay down the procedures, if you lay down the regulations, that actually children and families are passive recipients of all of that and will just take it and move with it. But in actual fact, they have very strong agency and voices of their own. My first question is, whose voices are we hearing? There's been a lot of talk over the last few years, most particularly in the last 15 months or so, about the voice of the child. And one of my concerns about that is that sometimes that's seen to eclipse the voice of the family, when actually I think that we should look at the two issues together, so that they're not mutually exclusive but complementary, because it is within the family that the child will prosper and grow, and the family need to have a very strong voice in what happens for them. I would have to say, from my research experience, while there's a lot of rhetoric about service user involvement, it isn't always very loudly heard, I think, in public consultation. And sometimes the very families that we find hardest to reach and hardest to help are the ones whose voices are actually muted. Because the people, and I am, I suppose, guilty of this to an extent, in terms of knowing that when I carry out a research project and I look for children and families to speak to, the ones that I speak to are the ones that are articulate and are confident and often have a particular view and may not necessarily be representative of the population as a whole. So the particularly problematic families may not be involved in a participative process. At a policy level, it is true to say there's been a lot of progress over the past few years to the perspective of service users. For example, the National Children's Strategy aimed very much to represent the voice of the child, as did Dáil in Óg. And there's a Children and Young People's Forum in the Department of Children and Youth Affairs. So these are all very constructive movements. But I suppose even when I think about the term that I use, which is service users, and that's because there has been a move away from client. Every few years the terminology changes, becomes something more acceptable, and then suddenly becomes unacceptable and we move on to use another term. But you all know what I'm talking about. But there is a tendency when we talk about customers, consumers, service users, it's like, somebody going into a shop or a restaurant buying a service. The people that we work with aren't always that interested in buying or availing of the service that's offered to them. So there is a tendency to maybe misrepresent and underestimate the power differential that's involved. And that's one of the points that I want to bring out today, is what it's like to be a disempowered service user, essentially. But of course, I would have to acknowledge that the more we see of evaluations and research studies that actually do interview children and families, the less disempowered people will feel. I think that for ordinary service users, you know, people out there sort of trying to avoid services, avoiding social workers, getting on with their lives, doing their best for their children. The main channels that are used these days are often freedom of information, which is a cumbersome, and this is in the news at the moment, a cumbersome and expensive way of finding out what is being said about you, what your files contain. And the Ombudsman for Children, the Information Commissioner and the Ombudsman are all channels that people use. I think it would be a much healthier society if there was less reliability on these kind of formal redress mechanisms and just more embedded service user participation. So when we talk about families as service users, who are we talking about and how do they become service users? This is something that's, I suppose, when you're doing evaluations and research, it's something you become very aware of because you have to find a way of reaching them. Therefore, you have to understand the channels through which they become involved with services. So, just looking at these different methods, some people, some families come to your service because they've been reported to the child protection system, to the HSE duty service essentially. And the reason they've been reported is that for some reason or other they're seen to be not meeting their children's needs or they're seen to be posing a risk to their children. Then some families are referred either via that mechanism or directly through other community staff to a community agency. So that's a different channel. Quite frequently families seek out a service for themselves, and I suppose when I was doing a piece of work a few years ago for the then Office of the Minister for Children and Youth Affairs, and we were seeking to find people to interview, I don't know why I was surprised, but I was surprised at the numbers of people who had become involved in the child protection system, not because somebody had reported them, but because they actually went seeking a service. And it was really interesting to observe over the years people's understanding of their rights to a child welfare service, that it wasn't necessarily something imposed on them externally, but something that as taxpayers, as citizens of this country, they were entitled to for themselves and their children. Then there's another group, and it's a more silent group in many respects, and then the odd time a group that has a very loud voice, and these are people who are alleged to have abused a child. And I suppose the people that I'm talking about, the people whose voices I've heard the most are people who claim that they were mistakenly reported to the child protection system. And it is a significant group in terms of the damage that it can do to a person's self-esteem and to their family if the investigation is protracted, slow or uncertain, and if there's any doubt left hanging over them. Is something that I suppose research has brought out to a certain extent, but maybe a group of people that aren't necessarily high in our awareness all the time. And then there are another group of people who come in contact with the services through various means, sometimes through private law or family law courts. So a variety of ways and means in which service users become involved in the service. Now I'm going to move on to talk to you about research, some of which was carried out in Ireland over the last 15 or 20 years, and some of which was carried out in the United Kingdom and in America and in Australia and other parts of North America and New Zealand and so on. I confess to be restricted to English-speaking countries, I'm afraid. And these would be countries that have very similar child protection systems, so it's quite easy to compare them. Now, I'm often struck by the fact that when I started in academic work about 20 years ago, a lot of the literature was very much concerned with governance of the family, state intrusion into family life, and a lot of tensions around that. And a lot of this came out of an event in England, which some of you as old as myself might remember, called the Cleveland Affair, which turned a lot of child protection ideology on its head, essentially, and really exposed what can happen to families when their rights are eroded and when they're treated badly in the child protection system. So there began to be a recognition of the need to not just protect the rights of service users, but listen to service users, make them partners, allow them to participate. I actually feel partnership is a rather false assumption because there is that power differential there. Most people would choose not to have child protection or welfare services as their life partners. But greater participation and greater involvement, greater say is always a very healthy way of promoting ownership of the learning that comes out of contact with services. So there was an increased emphasis then on user involvement, and stuff that came out of it was really the 1989 I think it's called the Children Act in the UK, which has been replaced now by the 2004 Act, but also our own Childcare Act did begin to reflect the need to work in partnership with families. In England we had the Family Rights Group. There have been different user groups in Ireland that have come and gone, but an example of one of the biggest shifts that came out of that level of concern was family participation in child protection conferences. Most of you here who are working in services where you go to child protection conferences probably think it's very unusual that I'm even bringing that topic up. But in fact 20 years ago when I was doing research, there was a very strong non-parental attendance norm in child protection conferences. If they were lucky, they were invited to wait outside, which was actually a horrendous experience. And we all know that the involvement of parents in child protection conferences isn't straightforward, but it's an awful lot better for parents and for the staff involved than the previous custom and practice that existed. So during the 80s and early 90s, there was a lot of concern about the child protection system seen as a very harsh instrument of intervention into family life. An academic called Dennis Howitt described it in 1992 as self-serving, unself-critical, and it was based on pseudo-empiricism. Very harsh criticism, but actually not entirely undeserved at the time. And we all know the sort of swings and roundabouts that go on in any sphere of public policy. And certainly the 80s was a period of huge change from a quite forensic, investigative lens, where family support was not very commonplace, was very disorganised, depended very much on charities, and certainly in this country on the availability of certain pockets like religious orders. The ISPCC was funded far less substantially or comfortably than it is now. Barnardo's would have been similar. The HSE or the health boards at the time had very little recourse. There were social services boards were probably the main source of family support in some areas. So what was left was the very little options for families, most of whom found involvement with the statutory system to be very, very difficult. In the early 90s in the UK, as a response to Cleveland and all the concern there was around that, there was a big programme of research, which is actually, even though it's nearly 20 years old now, it actually still contains really great nuggets of insight and information, and it's well worth consulting. And then in Ireland we began, from the time that the Childcare Act was implemented onwards, we began to build up a body of research ourselves that sort of has contributed to the, the international knowledge base. Now I'm going to talk about the research under 6 headings. Okay, firstly, I'm going to get the sort of the difficult stuff out of the way, I hope anyway. The impact of service users, what it's like to be at the receiving end of a child protection service, and then the degree to which agreement can be reached between service users and the statutory authorities. I won't read out all these out because that'll just be boring. I'll just go through them individually. Okay, so the impact of being investigated. Now, I mentioned that myself and 3 of my colleagues were commissioned by the Office of the Minister for Children in 2006 as part of the review of Children First that was taking place at the time, to get a sense of how service users from child protection felt about the services. But I'm also here drawing on research that was done in the other English-speaking countries that I've mentioned, so this just isn't entirely out of the Irish study. And as I say, this is probably the most difficult slide to listen to. The rest of it is much more constructive. But basically, when we talked and when other researchers talked to families, they spoke of the feeling of shame that they experienced of being involved with child protection. And that was whether or not they went looking for services or whether or not the services were imposed on them. Because basically, the message was, you're not an adequate parent, you're not an adequate person, you're not able to make good choices in life, your children aren't doing as well as they should be, and a lot of it is your own fault. There was a sense of being trapped, and by that I mean people had a sense that whatever they said would be taken out of context, you know, that they couldn't say anything that was actually going to be interpreted constructively or well. a massive power differential, a nightmare experience really. People used very graphic language. One man described it as like waking up inside a Franz Kafka novel, to be involved with systems where you felt that everybody else knew better than you did about your children. As I said, the terms like shame, stigma. And then what was very enlightening for us to find out, and is rather disturbing, is the unrealistic fears and misunderstandings, which have unfortunately been fed into again recently by some of the media coverage of the Roma children case, of the unrealistic assumption about the powers of social workers. As a woman said to me, they can come anytime, they can do what they want to my family. That's the sort of sense that some communities have, and I'm sure you're all very familiar with that. Very little knowledge about the system, and I suppose, you know, when you think about it, we think of child protection in terms of referral, initial assessment, investigation, family support, case conferences, strategy meetings, review case conferences, review this and the other. Families don't think about it like that, and I'm sure you don't need me to tell you. They just think, I have to do something to please that social worker or that family support manager or whatever. I have to be really careful or I will lose my children. That's the sort of down the line attitude. It hasn't been helped by very little public knowledge actually, or public, I suppose, positive depictions of the services, particularly on the part of the statutory services. And then what is also sometimes interesting, sometimes almost funny, was the dissonance of views on adequate parenting. You know, it wasn't so much, you know that only very few of the families that you encounter are the seriously abusive families. One, single figure percentages really out of the 100%. Most of the people who come into contact with services have problems. They've got lots of factors in their lives that aren't helping them, and maybe they grew up in families that weren't great themselves. So it's much more of a kind of a blurring, and just the views and the struggles between imposing middle-class views on parenting on people who, and there's an example, and some of you will have heard me give this example before, of a mother who could not understand why social workers saw it as a problem that she brought her children to the pub after school and kept them there for 3 hours while she met up with her friends, because as far as she was concerned they were warm and dry. They were in bed on time at night, their clothes were clean. What was the problem? And it's, these are the kind of dilemmas that you often have to wrestle with in terms of getting across to service users the best parenting practices when many people are struggling themselves. And that's the sort of sense that we picked up. Sometimes with families, their perspectives are just different, They don't see problems the way that the authorities see them. There was an interesting study done by the ISPCC in the UK in a particular area where they were talking to families about what risks do you see to your children in this area, and the families said there are a lot of risks in this area. The place is used as a rat run, so the traffic is very bad. There are burnt out cars in the area and our children go at them like magnets. There is drug dealing in the area. There's antisocial behaviour in the area. And they were all such sort of community-based problems, very different from what the child protection guidelines actually address. So you can see where the gaps kind of lie there. As I've said, parental behaviour tended to be minimised. It's often judged, the complex situations in which families are. Families living in homeless accommodation, in direct provision accommodation, in domestic violence situations. Single parent families struggling to cope. All of those issues have a huge impact on how families see themselves and their difficulties, and how they cannot stand being judged by people who are setting very high standards for them. So that is why families sometimes become very defensive and very evasive. And when you think about it, that's the way any of us would be if somebody was putting pressure on us that we didn't want. The good news is, and I'm going to move on to the good news now, is that research has shown that when you have dissonance and lack of congruence between services and service users, over time it can be eradicated. And the key, and I'm sure you all know this, the key to that is not multiple resources or fabulous community centres, and it's actually the relationship that they develop with the staff, and that's what I'm going to go on to develop. But before I do, I'm just alluding to a separate issue. I don't know whether there's anybody here today from a domestic violence service or a refuge, but it's because I've done research in that area and I've read a lot about that area, it's something that I feel very strongly about, is the position of women who are victims of domestic violence. Because in situations like that, you have somebody who's struggling to be a good parent and at the same time is under the most awful pressure. There's an ad, a very disturbing ad on at the moment. Have you heard it? It's a man's voice saying, I have to teach her clarity. I have to teach her to respect me. I have to tell her what to wear. You know, it's kind of creepy. But if you can imagine being the recipient of that kind of pressure, controlling behaviour. So obviously children's behaviour is affected. Children become more difficult to look after. It's very hard to remember to get vaccinations and all the routine things. It's very hard to get children's homework done. Children live in a very different atmosphere. But there can be a huge gap between what the service users want and need in a situation like that and what the formal services that we have are prepared to provide for them. And I'm not talking about domestic violence services or refugee services, I'm talking about the child protection system. Okay, so I said that the key to the merging of operational perspectives, that's to use a research term, it's when operational perspectives merge that you start to get really effective work done. The key is often the relationship. And in the research that I did and I read, we asked families to identify what were the qualities and the competencies of workers. So I'm just going to talk about the qualities first. And they basically, if you read all this, just nice people, really. They wanted somebody to be nice to them. They wanted somebody not to be, if you see on the third point there, not bossy, not snotty. Now I'm sure you all think, of course none of us would ever dream of being snotty or bossy. But I guess when people are under pressure and they're sorely tried, sometimes you revert to kind of primitive behaviours of bossiness and snottiness. So what they wanted was genuineness, empathy, helpfulness, willingness to listen, being non-judgmental, not being reliable. Parents have said, you know, trying to keep to a regime of maybe being drug-free or alcohol-free is very difficult when you're under stress. And what they appreciated greatly was if they slipped, that the worker wouldn't turn their back on them but would say, okay, let's get going again. Let's try and keep this going. Appreciating when workers were accessible and available. Now, we did get an awful lot of flack about people not returning phone calls, but moving to the positive, certainly a woman said to me, the case was closed. She was thrilled that the case was closed. The social worker was gone, but at the same time she'd lost a little bit of support. And she said, that social worker said, here's my mobile number, you can ring me anytime. And she said, and I didn't ring her a lot, but I rang her once or twice, and it made all the difference knowing that person was available. So having somebody in the background, and I'm sure that's the service that many of you do provide on an ongoing basis, having somebody in the background was a help, and knowing that if you rang them that they'd ring you back was enormously helpful. So the competencies then were, I suppose, that's the more sort of the skills end of it that families identified. They wanted workers to know the critical issues, you know, about stuff like domestic violence, understanding, for example, that leaving is the most dangerous time for a woman who is suffering domestic violence, instead of which some people had met social workers who could not understand why they stayed in an abusive situation. So they needed people to understand that. A deep knowledge about sexual abuse, about grooming, about children's difficulty in disclosing, all of that kind of thing. And then practical stuff like the impact of different drugs, what methadone maintenance involves for a parent, all of those kind of practical things. They really appreciated when workers were able to display a knowledge that they understood. It gave service users huge confidence if they felt that their worker was actually able to had a what you would call a formal knowledge about the problems that they were encountering. They liked people who were good at giving parental guidance about behaviour, discipline, diet, that kind of thing. They liked people who could bring everybody together. Most of the service users that are interviewed in research have experienced child protection conferences and are very well aware of the sort of hostilities and tensions that exist between services. They really admired workers who were able to coordinate the services, bring them together. They admired people who had different skills, specialist skills, people who had experience and knowledge about working with travellers or working with people with particular difficulties, for example. And they liked people who were empowering, praised them, encouraged them, told them they were doing well. The relationship was definitely the most important factor and often defined by power. So at the beginning of a relationship with the service, families often perceived the service to be absolutely omnipotent, needing to be pleased, and service users needing to hide any of their doubts. As they got more involved, the power differential, if the relationship was good, the power differential lessened or was diluted somewhat. And the things that made the relationship good were stuff like being believed. They didn't make me feel bad about myself. They didn't make me feel as if I was lying. You know, somebody had faith in me, confidence in me. They empowered me. Friendliness and encouragement, praise, and praise from somebody senior. A woman told me about how the childcare manager came out after case conference and shook her hand and said, "I just want to say, I've been chairing these conferences for 2 years, and I want to tell you, you've done really well." That absolutely thrilled her. Reliability and respect were also important, and they involved things like turning up on time, ringing when you were delayed, returning phone calls, responding to letters, anything like that. Tendency where staff are very, very busy to overlook manners, I suppose, and to treating service users the way you would not treat your friends or neighbours. So that was something that came out quite strongly. We tried to measure the degree of participation in work generally, and obviously I've looked at other research in that as well. And certainly in the early days, in the early 2000s, when parental attendance at case conference became the norm, experiences were very mixed. There were people who felt that they were being paid lip service to, that their participation wasn't meaningful, that they didn't really have a part to play in the decision. There were some of the words that people used were, and you know, this applies to everybody when they go in first, no matter how much they want to be there. Nerve-wracking, harrowing, difficult, and somebody said it was like a weapon. So extraordinary difficult experience. But what they did say was, the first one was terrible, the second one wasn't too bad. By the third one I was getting to understand who people were. And each time if a worker, a support person, a social worker, somebody who was there for them, could talk to them beforehand, would sit with them, would debrief them afterwards, and would recap what came out of the conference, that made an absolutely enormous difference to the value that they got from attending and also to the personal experience. Family welfare conference is not something that I have researched in detail. In the research I've done, there were too few of them, but there was a general overall favourable view, but actually some of the empirical research has shown that the outcomes are mixed. But I'll just leave it at that. I won't go into it because it's a totally different topic really. So then looking at the voices of young people, in all of the studies I've done, we've tried to involve young people, and I'm sure that Tess and Emma will talk about this later, the hoops you have to go through, the consents you have to get. It's really quite difficult to involve young people in research, but well worth it when you get there. Now, first of all, we're looking at young people who had grown up with domestic violence and asking them about their experiences. And they talked about all these awful things: fear, attention, bullying, isolated in the community, and school. School was such a huge thing. Concerned about people knowing. So wanting help but not wanting anybody to know about it. Wanting to meet other people who'd experienced but being too embarrassed to talk. Wanting to be in a group but not wanting to be in a group. It was all of those kind of dilemmas that they had. But generally speaking, the message was, we'd like teachers to understand us and treat us better. We'd like somewhere to go when we felt like talking. We'd like somebody that we could trust. We'd like somewhere to protect us as well. So that's just a flavour of what the experience was like for children. What they weren't looking for formal services, most of them wanted informal services. Most of them actually wanted their schools to be the service provider, because school was a haven for some people, but when school was bad, it was hell, and children were mercilessly bullied by other children because other children knew about their parents fighting and so on. So that was really difficult. So they wanted schools to intervene more. So there's a big message there for schools, I think. And then I'm coming to the end now, and it's a kind of a lighter note in a way, because we got great fun out of interviewing young people who had been involved in child protection. And their perceptiveness and their willingness to say things that their parents would not say was really remarkable, because in a sense the young people felt they had nothing to lose. Now, on the positive side, most of them had been kept well informed, and I think this is something that research is turning up more and more very positively, that children are more involved, they're focused upon more, and they were given a chance to express their views. The overriding feeling was, again, they wanted to be safe, they wanted to be protective. They found waiting for services to be very unacceptable. I suppose we're all used to waiting lists, but for a young child, waiting 9 months, having been assessed for sexual abuse, and then waiting 9 months for a therapeutic service, such a big proportion of their lives, and they really, really felt that. But, as I say, just to end on a lighter note, when we asked them about what were the qualities of workers that they'd like, experience. They wanted experienced workers. You know, because they were teenagers, they didn't want to be pawned off on a student, and they made that very clear. Just because I'm young doesn't mean I want a young worker. And as one of them said, I had one of them, and I swear to God there was no way she was past 18 years of age. I was like, here, love, I know the system better than you, I'll help you out. And then finally, and apologies to all the social workers here, but I could not resist including this one. They're so serious. Did you ever see a social worker smile? And actually, the rest of the sentence was, their faces would crack if they tried. So I know that doesn't apply to everybody. I'm sure it applies to nobody here, but it was a very amusing observation. So finally, the implications from all of this. What we drew out from our own studies, and I think what's generally been outcomes from others, is that for service users, formal and informal methods are essential. So we're moving in the right direction here with the differential response and the MEHL and the local area pathways, all of these things. You know, you might feel things are moving slowly, and you might be worried about resources, and you might sort of feel things are overblown or it's not as good underneath. But if you think of what it was like 15 or 20 years ago, actually we've made massive strides. And I think that service users would really appreciate that. I think that the lack of information about the formal child protection system really needs to be addressed, and hopefully that's something that the new agency will take on board, that there really needs to be a dedicated website that will actually reassure people about what happens when you make a report, both from a reporter and a service user point of view, that it's not just a case that somebody will be at your door to take your children into care, and that in actual fact a lot of constructive help is there from lots of ways and means. I do believe that there's a space for specialist services, and just coming back again to domestic violence, I believe that's an area that needs a specific type of approach, and I do believe there should be specialist sort of child welfare services within the domestic violence system. And obviously, I'm going to say I think that quality and competency issues require attention. Now, some of the research was done before the HICWA standards were developed, and before some of the other quality assurance processes that are now being operated were developed. And I know we might feel at times that these things are a total pain and that they're bureaucratic, but actually they are really essential. And I know that this should link well into the remainder of the presentations today, because I know that the goal of your outcomes, your outcome evaluation is to make sure that quality and competency issues are actually addressed. So that finishes. I hope I didn't grab too much of the time from the other speakers. Thanks.